So the role of robotics in head and neck is evolving, and we are shifting from highly morbid surgeries to minimally invasive and achieving cure rates which are similar to those as we do for open procedures but with minimal morbidity, shorter hospital stay, and minimal complaints that patient would have, that is pain or for that matter functional morbidity. Everything is curbed with robotics. Robotics is mainly for oropharyngeal tumors, like I would say throat cancers, like the base of tongue cancers, tonsillar cancers, or even the cancers, small cancers of the voice box, that is larynx, or of the food pipe, that is hypopharynx. Now, if we see various studies, we are shifting towards de-intensification of the treatment. That is, if we add chemo to radiotherapy for this kind of cancer, the cure rates are good, but the treatment is highly toxic. To subvert that, robotics have entered the scenario, and it has tried to reduce the amount of dose that radiation chemo would be required for the patient for the cure. Many a times, robotic surgery itself is sufficient and patient won't require radiation or chemotherapy, thereby reducing the toxicity and improving the functionality of the patient. Now, if we see multiple case studies, multiple randomized trials have come out which are proposing a role of robotic on a bigger stage as against other chemoradiation modalities. We have operated about 5 to 6 patients of robotic. We have done robotic thyroidectomies and our results have been wonderful. We have been doing this through the chest approach, that is, we go through axilla and areola and we enter the neck through a robot, and patients have done absolutely fine with complete clearance, a hemithyroidectomy, no thyroid residue left behind. So the hospital stay has gone down. Instead of 5 to 6 days of hospital stay, the patient would stay for only 2 to 3 days and would go back home. The satisfaction rate of patients with robotic surgery is quite high, and we are still in a place where we are trying to expand the indications of robotic surgery. We are trying to expand it to not only a thyroid, but we are trying to also do a neck dissection. We are also trying to have access towards parotid gland. We are also trying to have access towards skull-based tumors through a robot. We have a single port system which is coming out for robots, and we are trying to gain an access to the skull-based tumors. Those are tumors which are close to just above the nose, at the level of close to the brain, I would say. So we are trying to have access to that robotic, and of course with the minimal morbidity and with a good control in extirpation of tumor. So robotic surgery has definitely a role to play. It is still expanding. It is ever expanding in its role, and future holds a lot of promise.